Mark, let's start with you. Give us a state of the state of the program that you're involved with there at Health and Human Services.
Thank you, Luke. First of all, one of the things we've been working on for the past few years, and we're really finishing up, and that is the implementation of provisions of the 21st Century Cures Act, which was passed almost unanimously in 2016 and signed into law. And two of the provisions that we're really working on that we think are transformative for the healthcare system are interoperability and patient access. So let me just start real quickly with interoperability. That is the ability for providers and healthcare organizations to share medical record information, healthcare information on their patients with others. And that has not been the case previously. If you're seeing one doctor that isn't necessarily connected in the same organization as another provider, then they're not necessarily sharing information. So you could go to a doctor, you could have some lab tests and so forth, and then go to a second provider, a second doctor, and they're asking you about maybe those lab results because they don't have them. They may even give you a second test, something you had last week, which not only is costly, but it's just a lot of trouble. So again, this will allow and require health organizations and providers to share all your healthcare information with one another. Patient access, that's the second major part of this, and that allows the patients to be in control of their own healthcare information. And the provision requires that there will be application programming interfaces, which basically is the gateway to information on each provider's portal that will allow a smartphone app to go to that portal, collect that information, and bring it back to your smartphone. And those smartphone apps will be for the patients at no charge. So you will be able to see everything that's going on with your health, your lab tests, your conditions, your previous appointments, your after visit summaries, and so forth. So again, this is transformative, and it also kind of puts competition back into the healthcare market, which has been missing for a long time, in that when you see all that information, including pricing information, you'll be able to shop for care.